If you haven't been living under a rock lately, you may have heard of the drugs Ozempic and Wegovy. This class of drugs has been shown for an off-label usage to really reduce weight in a lot of people. And there's some pretty fantastic things that the drug is doing. But there are also some side effects, there are some other issues, and there's some research that has come out that said in these larger sample studies with people that there is a problem that they're losing muscle mass in addition to losing body weight. So that's not fantastic, but let's look at the whole picture. Let's look at what's good about it, what's bad about it. We'll look at the what the drug mechanism does and whether you should consider using it or talking to your doctor about it. My name is Dan, this is the Angry Physio, and let's talk. So Ozempic and Wegovy are in the class of drugs called GLP-1 receptor agonists, and they originally came out to help people who were diabetic. There's a lot of positive stuff to say about these drugs. These drugs enhance insulin secretion, they inhibit glucagon release, so both of those things are regulators of blood sugar, so it helps to control blood sugar. And above that, it does some other fantastic stuff. It delays gastric or stomach emptying. So that kind of slows down how much you would eat when you're taking this drug. It makes you feel more sated. So I know some people who've taken either one of these drugs and said that they just don't feel as hungry. What a fantastic way to lose weight. But that's not it. Like there are other positive effects that it has as well. It actually affects the heart and the blood vessels, and it's been shown through research that suggests that there's an anti-inflammatory effect and kind of an anti-clotting or an anti-atherosclerotic effect. And above that, there's a neuroprotective element they think these drugs offer. It can be used as a treatment for Alzheimer's disease. And I don't know if you've looked up Alzheimer's disease in scientific literature before, but in the last couple of years, a lot of researchers have been referring to Alzheimer's disease as diabetes type 3. So it kind of makes sense that if this drug was used to treat diabetes, it could also be used to treat Alzheimer's. So there's a whole lot of positive effects that these drugs can have. So here's one possible drawback when you take one of these classes of drugs, or really any drugs. And the word is polypharmacy. And polypharmacy is kind of just what it sounds like. It's taking many drugs. So if you are taking one of these drugs, Wegovy or Ozempic, to lose weight, or if you have diabetes, etc., I'm going to guess that most of you all who are taking this drug are probably also taking other drugs. So what happens a lot of times is that the more drugs as you take, the higher the probability is that these drugs may have some weird interaction and cause some secondary problem or adverse effect. So that's one thing to be careful of. And if you want to check this stuff yourself, I always tell patients to advocate for themselves. If you take a look here at the screen, there is a website called drugs.com. And it's fantastic. And what you can do in drugs.com is go to the drug interaction checker that I'm right there on my cursor. I clicked on that. You can enter a drug name in. So let's enter in Wegovy. I'm going to add that to my list. And I'm going to add in a couple other drugs as well. Let's say you're also taking losartan. Oops, I misspelled it. Losartan. Okay, so I'm adding losartan into that. And let's add maybe one more in. Let's add, let's say you're taking insulin because you're diabetic. So you've got those three in there, and just click check on the interactions. And when you check on the interactions, let me scroll down here. This will automatically give you some effects that you would see, and whether they're mild effects, whether they could be moderate effects or severe effects. So if you're, for example, if you're taking insulin and Wegovy, that can increase the risk of hypoglycemia, which is really low blood sugar. And you may need to adjust your doses, and you basically have to stay on top of it. And they also list a bunch of symptoms there, etc. So be an advocate for yourself. Enter your drugs into drugs.com. By the way, your doctor should know this, but the way that I operate my practice is that I assume that a lot of these doctors are not aware of what's going on with their patients when they're seeing other specialists, etc. So really good idea. So like I alluded to before, there are some studies that suggest that muscle loss from taking these drugs for a longer period of time is definitely a risk factor or an adverse effect. Let's take a look at the summary of this study right here. And if you can see as we scroll down this summary, I'm right in the middle of that paragraph. Available evidence suggests that clinical trial participants receiving the treatment for obesity lost 10% or more of their muscle mass during the 68 to 72 week interventions. That's a lot. And they say it's approximately equivalent to 20 years of age related muscle loss. Um, that's a huge problem, I think. And what they suggest down at the bottom of the paragraph, and I'll comment about this: nutrition therapy should ensure adequate intake and absorption of high quality protein and micronutrients. And it also says concurrent physical activity, especially resistance training, has been shown to minimize muscle loss. Well, yeah, I mean, we already know that. We know there's a lot of evidence that really is pushing that fact. Resistance based weight training and resistance exercise is probably the closest thing to the fountain of youth that we've got. And it really helps with blood sugar control and weight loss. So let me just put in the suggestion here: try that strategy first. So it's a big deal when you put another drug in your body, especially when you're taking other ones. But if you can resistance train and control your diet and you're losing weight, why would you want to take that drug? That's just healthy living. And if a patient came and asked me about that, and a few of them have, I push that first. Now, I do realize there are circumstances where people have already tried that and it's not particularly working, to which I say, let's take a good hard look at what you're doing, like what you're eating, when you're eating it, how much exercise you're doing. Let's look at that with a fine tooth comb and see if there's any adjustments we can make. But I mean, I do think that there is definitely a patient population that's going to benefit from this drug or drugs. So, what are some of the other problems that practically that we're going to see with this? Well, one is certainly, if you're going to take one of these drugs, you're probably going to be taking the drug for a very long time, maybe even for the rest of your life. And you got to think long and hard about that before you make that type of decision. Part of the reason I would probably steer away from taking it is that these drugs haven't been around for a super long time. So, really, like longitudinal evidence uh, on what the effects could be over 20 years, 30 years, that type of thing, I don't think we really know. The early stuff that's coming out is promising. It looks like there's not a lot of adverse effects, but you definitely want to be careful about that. And the second thing, too, is that these drugs, at least right now, they're very expensive. And that can be a deterrent for a lot of people. And you really have to think about how that's going to play into your lifestyle over a long period of time. So, in conclusion, there's a lot of information coming out about these drugs. There seems to be a massive upside for this. I think we're going to see in the next 10 years how this all plays out. It has a lot of positive effects that we've talked about, but remember, it is an investment, both monetarily and time wise and longevity, in terms of the fact that you're going to have to commit to take this drug for a long time. So, my advice as a physical therapist is that if you are going to take this drug and you have not gone the other route of lifestyle change and resistance based exercise, you need to do that first. Thanks as always for watching us. And if you have any questions, drop them in the comment bar and hit the like and subscribe. We always appreciate the likes and the subscribes. Have a great one.